Hello. So today's topic is what is ulcer and how ulcer happens. So everybody, and at least once in their lifetime, they will say that I had ulcer or I have a gastritis, acidity. Usually people give the terms, all the terms for one single disease like acidity, gastritis, acid reflux, ulcer, stomach ulcer, duodenal ulcer, peptic ulcer. All means only one single problem. It's simple. Suppose if you have a wound here, we call that ulcer in the hand. The same way, if you have a wound or maybe a cut or a wound, we call that ulcer in the stomach or ulcer in the duodenum. How it happens? Usually, I always say this is the penalty we pay for our lifestyle. The penalty in the sense, the lifestyle sense, not much big of a thing. Only thing, main thing is either avoiding the breakfast or taking too much of food, too much of spice, too much of unwanted food, junk foods, and stress. All these things put together, we call that lifestyle changes. Generally, usually it happens because of the stress. Stress is nowadays a big issue. Stress in the sense it could be work stress, a family stress, a personal, financial, or even simple fear. Most of the people come to me with a lot of they go through the Google and they come with fear factor. So all these also a stress factor. So when you are under stress, acid is pulling. You have too much of acid. Automatically it secretes. So this can lead to over a period of time ulcer formation. This stress. Lifestyle change, as I told you. The second is stress. Third is probably sometimes certain drugs like maybe painkillers or hormone tablets or these things can over a period of time can cause ulcers, and some people going for surgeries and prolonged hospital stay, they also get stress ulcers kind of thing. So ulcer is nothing but a wound. So we have a wound in the stomach, and most of the time the ulcer presents like pain, but this is 90%. The rest of the 10% of the time it can happen like just like a loss of appetite, bloated feel, early satiety. You feel hungry, but when you eat even small food you feel full, or especially you pass a lot of more frequent motion, especially after food. Burning sensations, or sometimes breathing difficulty, choking feel. Sometimes, especially in the night time when they are lying flat and sleeping, they may feel choking feel, or even something like heart attack feel. These are the other forms of presentations of ulcer. Sometimes very severe back pain. All these are signs and symptoms of ulcer. So to understand simply how to protect ourselves against ulcer or acidity problem. So as I told you, it's a wound. Suppose if there is a wound, if you pour acid, what will happen? It will give it will burn more. The same way, if we have too much of acid, the ulcer will not heal. So what to do? First is you should sleep at the right time. Why? Only during sleep body repairs. First thing, only during sleep acid level in the body is very low. So good sleep, the right time between 10 o'clock to morning 5 o'clock is the best thing. Second, suppose you have a wound or ulcer and you add chili, spicy things, what will happen? It will burn. The same way, if you take spicy food, the ulcer becomes worse. So avoid spicy things, or even oily, fatty meals. When you take fatty and oily meals, you need more acid and more bile to digest, so that again will aggravate the already existing problem. And avoid tea, coffee in empty stomach, or at least completely quit, or at least in empty stomach, because tea is nothing but tannic acid and caffeine. They can irritate your stomach. And avoid painkillers. If at all, just take exactly what your doctor prescribes and take something to protect your stomach. These are the main things. And suppose there is a wound and you pour alcohol, what will happen? It will burn. The same way, if you take alcohol, the ulcer will never heal. The same way, smoking, if you smoke, the wound will not heal. The same way, the stomach ulcer will not heal. These are the simple things: changing lifestyle and getting the right proper advice, consultation with the gastroenterologist. The main idea of visiting the gastroenterologist is to identify what is the reason why you are getting the ulcer and how to prevent in the future. For treatment for any ulcer is almost the same, but why it happens, that we should know. Probably he may ask for, the gastroenterologist may ask for a endoscopy or ultrasound, other things to look for the reasons of ulcers, and getting the right treatment, right advice, and knowing the root cause and changing the lifestyle. These are the key factors for the stomach ulcer. Thank you.